reading up on you, I discovered that you performed the first outpatient hip replacement at Baptist Health Hospital. Tell us about that and the moment that happened.
Yeah, so this started a few years ago. We're starting to see these transitions in healthcare across this country. And there's been a push, we do have some younger patients who are interested in getting out of the hospital. And with these changes in the way we're doing the surgery, the pain control, the blood conservation, and also our surgical technique has really allowed patients to recover very quickly, to be up walking within a few hours. And a few years ago, some of the nurses decided they wanted to try to push this program through. And we've been quite successful, especially on the hip replacement side.
Isn't outpatient important, though, if you think about it, because it's not traditional? People are not spending a tremendous amount of time in the hospital because it can be nerve-wracking to be in the hospital overnight or for a couple of days. Get them in, get them out, put them back into their homes. And doesn't that help the overall recovery?
No doubt. I mean, hospitals are traditionally for sick people. Hospitals go when you're having a medical issue, you go to a hospital, you get better, you find out what's going on. Patients who come to the hospital for joint replacement surgery are healthy, and they want to stay healthy, and we want them to not be treated like patients. We want to treat them like recovering individuals. And so the best place to recover is at home. And we know medically we're doing better with the surgery. And that's the reason why outpatient surgery has taken so much interest in this country.
What about, though, monitoring the patient from home? Because now you no longer have them sitting right in front of you, or you don't have them in the hospital, you don't have them immediately there. Is there an inherent risk to this, or is there really more responsibility that the patient has to take if you're sending them home right away?
Obviously, if a patient is not medically safe to go home, they're not going home. We will keep them in the hospital. And there are patients who we know are not going to be candidates for going home the same day of surgery. These have to be healthy patients with supportive friends and family, and also understand how the healthcare system works somewhat. But currently, we're not monitoring patients at home. We're not going to let someone leave unless we know they're safe. But there are technologies out there that will be coming over the next few years that will allow us to monitor patients at home.